What we found in SELECT is that there was a progression-free survival benefit with lenvatinib compared to placebo, which was really quite significant, more than 18 months compared to less than 4 months in terms of median progression-free survival overall in the main randomized portion of the study. The data that I presented here at the Endocrine Society meeting was on the open label extension part of the protocol. So on the main part of the protocol, when patients did experience progressive disease that was independently confirmed by radiology review, they were unblinded, and those patients that were on the placebo arm then were allowed to go on and receive open label lenvatinib. The dose of lenvatinib that was given was 24 milligrams per day, and I reported on the outcomes of that patient population. What we saw in the open label phase of the study was that the progression-free survival was about 12 months in the open label phase of the study, which is a little bit lower than what was seen in the randomized portion of the trial. We did see a very good response rate in the open label phase, with 55% of patients overall responding to lenvatinib in the open label phase of the trial, and there was also one complete response that was noted. I think it's a very important question about why we're seeing a slightly shorter progression-free survival when patients are starting lenvatinib early. I think we haven't yet had studies that have looked at exactly when the best time is to start these therapies for patients with iodine refractory differentiated thyroid cancer. That disease can be rather indolent, and patients are often followed with TSH suppression and watchful waiting for a long period of time, and might not be referred for clinical trials until they have a significant disease progression or are symptomatic of their disease. The most recent phase 3 trials have required that patients have progressive disease based on RECIST criteria before study entry, and I think that is an important criteria that in general should be in place before these drugs are considered for patients. But we may be seeing data that's suggesting that we don't want to wait too long before starting patients on these therapies, especially a therapy with like lenvatinib that has a really good response rate and seems to be highly effective.